Come back. So this is the surgical kit we use for full mouth implant surgery and also for regular implant surgery and also for infection. So this is a standard kit we use for extraction, infection, full mouth implant, partial implant or cyst removal, whatever it is. So we can organize a separate kit for extraction or for infection, full mouth implant surgery, but that will complicate arranging the instrument and all. So if you have a universal kit, so any procedure we can have that kit. The main thing is it should be in a single place, either in a sterile pouch or in a box like this. Okay, so we prefer this pouch. Okay. So what are all the instruments needed? So during surgery you have to open it, throw it, and over the sterile area you have to arrange the instruments first. Okay. You don't have to wait for me to come and open this. You can do yourself before starting. So in what sequence you have to arrange, that is more important. Okay. First is mouth mirror. Second is no, probe is not needed. Okay, only rarely probe is used, so keep it away. So next is the BP blade. So in what sequence you will be doing the procedure, the same sequence you have to keep it from right hand. Okay. So usually what we do is we keep this and we arrange the instrument. You should not do that. Okay, keep all the instruments which will be used in the later half of the surgery, keep it up. So first we need a BP blade, BP handle, mouth mirror, BP handle, then raised elevator to elevate, then we need alveoloplasty Ranger. So you need a alveoloplasty instrument. At the same time you may need a Austin retractor to retract the flap. Okay, then Ranger. Okay, then only comes the curette. Okay, so needle holder with the silk suture attached you may need to put a retraction suture for full mouth we are discussing. Then you need a curette. Bone file is not useful because with alveoloplasty bird itself you will be smoothing the, for the namesake it is here. The bone files which is available in the market, they are not good also. Okay. So the first procedure is extraction and alveoloplasty. So keep the instruments needed for that. You may need a scissor to trim the granulation tissue and infected papillas. Okay, and always keep two BP handle. Okay, because you will need definitely two blades. Okay, usually what we do is using only one blade to put all the incision, but it is better to use 2 or 3 blades depending upon the situation, because the BP blade loses its sharpness in few passes. Okay, so this is a good Ranger. So each and every instrument we will see. Okay, so this kind of BP handle don't use because it may become loose and you will have lost control during incision. So regular BP handle is enough. That's okay. Okay, and make sure the blade is not loose fitting here. Sometimes the blade will be loose fitting here. Throw that BP handle away. Actually, one handle is loose. Otherwise, what will happen? Intraorally, if the blade slips, then it is risky. Okay. And periosteal elevator also, keep 2 periosteal elevator. Usually we keep 2 mouth mirrors, right? Why 2 more mirrors?
For the assistant.
Yeah, one for the assistant and one may be needed for by the operator. And not only that, it is the most commonly slip down. It may fall on the ground, so you need to have a backup. And 2 periosteal elevator is needed. Why? Sometimes if one periosteal elevator is not sharp, you are not comfortable, you can use the other periosteal elevator. Okay. And backup if it falls down, that is why. Because it is the most commonly used elevator, or the instrument during procedure for flap elevation, for luxation, for removing the roots. Okay. Then coming to the curette, always check the sharpness. Okay. It will become blunt easily. So there are 2 kind of curettes. One is fully round, and another one is a serrated one. So you will have a serrated one. So prefer serrated curettes. So always prefer the serrated curettes. They curate the socket or the cystic cavity well. Okay, instead of the blunt one. So when buying, you have to check this. Okay. I think in Jalandhar surgicals they are having that serrated curette, very beautifully working that one. Economic also. Coming to the ronger, always buy double action ronger. You can see here double action. When you press it, it moves in one direction here, it moves in another direction here. Single action ronger is useless, and you need to give a lot of pressure to get the action done. So always use the double action ronger and make sure it is not becoming blunt. Okay, you have the option of sending the ronger back to the company. They will sharpen it and they will give it to you back, or you can use a stone. Okay, sharpening stone is there. It is available in online. You can buy and you can use the sharpening stone to sharpen the blades. Okay, so having a good ronger will save you a lot of energy and time. Okay, and a good Austin retractor. Okay, make sure the Austin retractor is not wide here. Okay. So this is the serrated. You can see the serrated tips. It is from, what is the name? Yeah, jewel dent. Okay. And rarely you may need a straight curette. Okay. In full mouth it may not be needed. For upper anterior extraction only, if near the apex there is a cyst, this angled may not go till the apex. Okay. This part will hit the adjacent teeth. So you may need a straight curette only in upper anteriors. Okay, when the adjacent tooth is present. Okay, otherwise it is not needed. Okay, and you need a good sharp scissors, curved scissor always. Straight scissor is not useful. Okay, I think this is from GDC, right? GC or GDC? GDC. Okay. Sharp end and round end, both scissors are available, but sharp end scissors are better. So this is useful for trimming the soft tissue, and also you can use it for cutting the sutures. Okay, and a good needle holder is must. This is also from GDC with the coated tips. Okay, make sure it is not tight. If it is tight during suturing, it will difficult to handle the needle holder. So, and make sure you are not using the needle holder to bend the wires or to remove the root stumps and all. Otherwise, a gap will be created near the tip, and it won't hold the needle holder properly. And make sure all the needle holders should be 6 inches. 6 inches means in your hand it will be from the tip of your middle finger to this part tentatively. So almost all the oral surgery instruments, they are almost the same and that length. Okay, except the artery forceps. Okay, so any instrument at this length, the needle holder. Okay, any instrument at this length is essential to access the deepest part of the oral cavity. anterior, upper anterior, lower anterior, any instrument will do. But if you are working on 6, 7, 8 region, you need this length instrument. Any instrument more longer than that, it will be uncomfortable. Okay, your dexterity and fineness will come down. Okay, and this is the tooth forceps. Okay, during suturing to hold the tissue. Okay, for what else we are using? For retraction suture, we will be using this because the palatal tissue is very thick. Okay, so it will support the palatal tissue and you can take the bite easily. Okay, this is also an essential instrument. While doing suturing, you have the option of using this or not using this. Okay, without using needle tooth forceps also you can do suturing, but if you use that, the work become very elegant and you'll have more control. Okay, instead of using finger. Sometimes using finger it may be needed, especially upper palatal. Okay, so this is mosquito artery to remove small root stumps or for what else. For emergency it is useful. For any soft tissue bleeding from palate, you can catch the vessel and if you leave it for 5 minutes the bleeding will stop. Okay, and you need a longer artery forceps also. That is a very, very important instrument, because if some root stumps are small, small instruments, X driver, if they fall into the throat, you need to take it. You need a longer instrument. Okay, the tweezer is not ideal for that. Okay, it may slip sometimes. It won't hold tightly. So you need a curved artery forceps, longer one. So this is an emergency instrument. This usually we keep over the patient's shoulder, so that any emergency we will take it and we will remove the root stump or broken crown pieces. They will be sitting near the tongue and the throat junction. Okay, so actually we don't have that enough stock of that long artery forceps. Okay, so remain with it. And so this is the extraction, incision, flap elevation, alveoloplasty segment. So during the segment, for alveoloplasty you can use the ronger. Okay, this is we got from the SKA surgicals. It is good, but it will soon become blunt. That is the problem. Okay, so we need to use the straight arm piece. Where is the bar? So for alveoloplasty you have 3 options. Okay, one is using a ceramic trimmers. It comes in multiple colors based on the coarseness, roughness. Okay, and we have the metal alveoloplasty burr. You don't have to search for alveoloplasty burr. These are regular lab side burr, edenta burrs. So edenta burrs are good. They come for long life. Okay, edenta. Okay, so this end is sharp. This we don't prefer. The end should be more rounded. Okay, something like this. Okay, and when the ridge is very thin ridges, you can use the round. Especially when you are doing alveoloplasty next to a standing tooth, this is quite useful. Okay, it is available in 2 sizes, smaller one and bigger one. Okay, this ceramic trimmer that you can get easily from online. You can search. How will you search? Nail trimmers. Okay, you will get it. But the thing is, it will soon become blunt and it won't cut. It will just generate heat. So make sure you are disposing it soon. It applies to all the burrs. If you use the old burr, 1947 burr still now, it won't cut. It will take your energy. You have to give a lot of pressure. The moment you give a lot of pressure, the risk of slipping is there. Just to take a mental model. So when using the alveoloplasty burr, the most important tip is use the burr in this angle. Use the burr in this angle. Don't use the burr in this angle. Okay, it is highly risky. You may slip here or you may slip here. If you slip here, you will injure the soft tissue and mental foramen. So always do in this motion, especially when the bone is sharp here. We have the temptation to smoothen like this. Okay, but use the final smoothening. Use a big round burr. Okay, initial gross direction use in this direction always. Sometimes I use in this direction, but I fully concentrate and I am having greater control. I am doing this, but 99% I will be doing in this direction only. So this is an important thing to remember. Okay, so after alveoloplasty only you go for the curette. Okay, finally only you are going for curette. Why?
The bone debris.
Before alveoloplasty, the sockets will be longer. You have to curette. No, why unnecessarily curating the long socket? After alveoloplasty, there won't be any socket at all. Sometimes there won't be need to curette at all. So curette is the last step just before drilling. Okay. Drilling. So probe is useful only when you want to remove the sharp root tips. Otherwise, this is not useful. One is to remove the root tips, and another use is
blockage.
To remove the blockage of suction tip, metal suction tip. Okay. Then sometimes you may need a periotomes to remove the root stems. Okay. And sometimes you may need a 702 or 703 burr for open method, nothing else. Okay. So that also you have to keep in mind. Silk suture you may need to put a retraction suture for the palatal flap and lingual flap. Okay. Then you are now coming to the drilling part. Where is the scale? Sorry, pencil. Okay. So. So during implant, you will need the drills, implant carriers, ratchet handles, and if you are using a screw retained option, either with conventional or with laser, you may need extra driver, appropriate X drivers. Okay, and you may need a bone wax also. No, bone wax. Start. Now, and another thing we need is a bone wax. Where is bone wax? So you may need a bone wax. Okay. What is the brand? Ethicon bone wax. Sometimes you may need to arrest the bone bleeding. Okay. Or you can use the cautery. Okay. Now, and one important instrument to have in all full mouth rehabilitation is pencil. Okay. So where and all you are using the pencil?
For marking. Marking.
For marking only. Where?
Nasomaxillary buttress area.
Yeah, to mark the nasomaxillary buttress area and to mark the starting point, and also in the anterior we can use it, and for zygoma we can use it, and to mental foramen location you can just mark above the mental foramen location. Then you don't have to see again and then again where is the mental foramen. So it is a very essential instrument for zygoma, non-zygoma, nasomaxillary buttress. Okay. It will reduce the errors. We think we can drill just by seeing, but having a marking is better. Okay. In abroad, in one course, they are using the pencil by default. In zygoma courses, they are using they will reinforce the value of pencil using that pencil. They might have done more than 1,000 zygomas, but the surgeon will be using the pencil in each and every case to mark it. Okay, and then finally suturing, right? Suturing we use 3 sutures. What are the indications we will see? Catgut we are not using, it resolves faster. So 2 sutures we will be using. If there is no bleeding, we can use the Vicryl. Okay, Vicryl Rapide. It will resolve faster in 5 to 6 days. unlike the regular vehicle, which doesn't resolve even after 10-15 days. 30 vehicle rapide. Okay. And another suture is 30 ethylon. Ethylon means it is polyamide, monofilament. Polyamide, no? Okay. This is good. Okay. Considering the knot stability and secure tissue stability, vehicle is poor. Okay. But ethylon is good. The only drawback with ethylon is it is not resorbable, you have to remove it. And what is the other drawback? If you are not cutting the suture end properly, it will poke the patient's cheek. Okay, so you have to cut appropriately. Okay, otherwise for arresting the bleeding, it is good. So if you are using vehicle, you have to put lot of sutures. If you are using ethylon, you can increase the inter-suture distance. That is advantage. Okay, there is something called inter-suture distance. That means distance between the each one and the next suture. If you are using vehicle, better to place sutures a little bit closer. But if you are using ethylon, it will be reduced to half. Right? If you are using 12 sutures with vehicle, you can put 6 or 7 with ethylon. So it will reduce the time. The bleeding control is good with ethylon, and the knot stability is excellent, right? In vehicle, the knot will loosen, right? The risk of knot loosening during suturing itself is more, but with ethylon, the knot stability is good. Anything we missed? Drills we'll see it. Okay. So after this kit, there are some useless instrument. What is the use of useless instrument? That is the bone file. Okay. So the purpose of bone file is to smoothen it, but almost all the bone files available in the market, they are not doing that job. It is not good. I don't know why. Even if it is doing good, only few cases it will. After that, it will become blunt. So better to use a round burr to smoothen it. That will do the job very effectively and efficiently. Where anything missed? So, and the important point is those who are assisting it, they should know the sequence, and they should be ready with the appropriate instrument. Arm straight.